have now at the Multiple Myeloma Research Foundation a community gateway where people, if they're not able to attend a support group, they can chat with people online, and they're matched by the state of their disease. So if you want to speak to somebody who's early diagnosis, you can speak to somebody at that. And we're actually expanding that because not everybody can get to a personal meeting. So a lot of these digital avenues we're starting to take with teleconferences and digital websites to help get access to information.
In terms of providing patients and their families with the most comprehensive information about what's available, that's obviously part of the overall marketing and education strategy. But I think we're also working, I think, very hard to make certain that there is an important element of hope based upon the work that's going on to transform the technologies we're bringing to bear. I mean, it's interesting that the panel has, I think, clearly described the impact of the diagnosis and the trials and tribulations of treatment on mental status. And clearly, mental status impacts outcome. There's no doubt that there's an important connection between behavioral and psychological inputs into your immune system. And so a healthy immune system makes you the best candidate for the best outcome, best response. So one thing which I think would be central to everybody's own information gathering strategy is to see just how much promise there is in the research and development that's ongoing. It also, I think, helps to support the important concepts from the earlier panel today, which is that investment in innovation is central to our objective and mission at turning this into a chronically managed, just something that everybody can deal with, just like what we did to things like diabetes. And I think that's one of the great contributions we're beginning to make more and more in industry.
Social isolation can be really challenging to survivorship. And so when you're talking about connecting with support groups or talking to someone on the phone or reaching out to your neighbors or your church or wherever you find support, psychologically, in research has shown that people who are more socially isolated, and you can be socially isolated and have this wonderful family of support around you, but when you're going through the experience, you feel very alone because you're not sure everybody really understands how you feel. So that connectedness you found in those groups and in talking to others, I think has really made a difference in reducing that feeling that you're not alone. And I think for multiple myeloma, because it is so complex, you're learning from each other and learning how to communicate with the physician, how to advocate for yourself, how to battle with the insurance company if that's an issue, and find the wonderful corporate support programs and other nonprofit organizations. You learn best from each other. And you're the experts when it really comes down to it.
And let me add one other thing. It's very, very clear to me that patients who are battling this disease and their families want to be active participants. You want to have a bi-directional exchange of information. Biomedicine is an information science nowadays. And everything that transpires during the process from diagnosis through treatment is information that's important to those of us in industry. And it's clear. You see great companies like Google now focusing very intently on healthcare, but wanting to capture all the information about the journey that you take, because this is going to ultimately yield important insights and subtle nuances about what your treatment in the context of your nutrition means, what your treatment in the context of whether you're taking oral agents or injectables. I mean, these are all pieces of a very big puzzle that requires intensive computational activity at the level of the cloud and so on, in order to give doctors the best information on how to maximize your therapy.